This is The Countdown on ABC 7 New York.
Previous plan was wait until they do something that endangers the life of themselves or others. We're saying no to that plan.
Today, New York City Mayor Eric Adams unveiled a new plan designed to help and treat those individuals dealing with mental illness. Among the plan's directives, giving outreach workers and first responders the green light to transport people who can't meet their own needs and present a danger to themselves, all because of severe mental illness. But the plan has its critics. For insight now on the mayor's plan, we're joined by psychiatrist Carole Lieberman. Carole, can you hear me? Thanks for joining us. Good to have you with us.
Fine, thank you.
Carole, based on what you've seen and heard about the mayor's plan, your thoughts. Is it the right approach to dealing with the mental health crisis in New York City?
Well, it is the right approach in terms of letting people who are gravely disabled. I mean, there was already a rule, so to speak, that people who are a danger to self or a danger to others or gravely disabled, meaning they can't provide their own food, shelter, clothing because of mental illness, they are eligible, so to speak, to be involuntarily hospitalized in a psychiatric hospital. Now, the problem with the plan is that there are way more people who meet this definition and who should be involuntarily committed to psychiatric hospitals than there are beds. I was the chief resident at NYU Bellevue, and so I know what it was like and what it is like, and even now, the worse now, of course. There aren't enough beds. You know, the governor was saying, well, we're going to add 50 beds. 50 beds? That's a drop in the bucket. Mm-hmm. We're talking about the majority of people who are homeless have some mental illness. And so, and the problem is that the hospitals if there are any beds to begin with, they bring them in, they keep them for 3 days, give them some medication, and they discharge them. Well, schizophrenia and manic depressive illness, also called bipolar, those are chronic mental illnesses. You can't get fixed in 3 days. And so what happens is they go out. When they run out of the medication that they were given, they go back to being psychotic, and then they can't find their own way to a clinic. But
let me jump in here, Carole, because you studied hard to become a psychiatrist, and the question becomes, should first responders and outreach workers be the ones determining and diagnosing an individual's mental health?
Well, that's a very good point, but I would certainly hope that the outreach workers and the police are just the ones making an initial kind of determination, bringing them to a psychiatric hospital, where then a psychiatrist would decide if they meet the criteria.
The mayor says his long-term strategy, Carole, involves an immediate shift in what he called the city's moral obligation to help those in need. And yes, it includes drop-in centers and safe havens and stabilization beds, more action, more care, more compassion, he says. Sounds good. Is it sustainable?
Well, the problem actually began years ago when they closed the state mental hospitals. We are seeing the problem has only gotten worse since then, and it is the same issue that you can't treat schizophrenia or manic depressive illness in 3 days. They need to have a place where they can be safer, first of all, than it's not cuckoo's nest. I mean, that's what people used to say that's why we have to close the mental hospitals. They're like cuckoo's nest and it's not fair and we're taking away their liberty and all that. Well, it's a lot better for the people. They're not all cuckoo's nests. And it's a lot better for people and safer for the patients to be in an environment where people are taking care of them and trying to get them well. It's just that it takes longer with therapy and with medications, finding the right medication for each one, than 3 days.
Final question for you, Carole, and it sounds like you agree with the assessment perhaps offered today by the Coalition for the Homeless. They had this to say about the mayor's plan. Mayor Adams needs to focus on repairing our broken mental health system and prioritize bringing access to quality voluntary care and affordable permanent housing with support services to New Yorkers who need it the most. Yes? Is that your understanding?
Yes, starting with state hospitals. There are too many people who are too sick to do it in any other way. The clinics, it doesn't work to have outpatient clinics.
Doesn't work. All right. Carole, appreciate the insight, and thanks so much for joining us on The Countdown.
Thank you.